أحب أولا أتوجه بجزيل
أرجو المعذرة أنه ربما بيحصل شوية تغيير في البروجرام لأنه تأخرنا شوية.
السكر اليمنية والقائمين على المؤتمر
وقبل ما نبدأ محاضرتنا مع الأستاذ الدكتور سميرحلمي من مصر، ومحاضرة الدكتور زايد بتتأجل إلى وقت لاحق. انتظر يا
My talk will entail medicine in ancient world, important landmarks in history of diabetes, updated data, some spotlights on the future of diabetes. This is orthopedic surgery and prosthesis in ancient Egypt. The records show that the Egyptians used emetics, purgatives, enemata, diuretics, diaphoretics, and others.
أولا شرف لي أقدم أستاذي وربما أستاذ أغلب دكاترة الإسكندرية من الجيل الرائع للدكاترة الإسكندرية وأساتذة الإسكندرية، الأستاذ الدكتور سمير حلمي أسعد خليل. الأستاذ الدكتور سمير أسعد، يعني لو تكلم واحد عن البيوغرافي للأستاذ الدكتور سمير يعني ربما يحتاج يعني ساعات حتى يعطي الأستاذ سمير حقه. هو من دكاترة الإسكندرية دراسة وتخصصا إلى أن أخذ الدكتوراه من الإسكندرية، وأخذ يعني دراسات عليا تخصصية في الإديوكيشن والإميونولوجي والديابتولوجي والليبيدز، يعني إن فرنسا إن باريس وفي جرماني. الدكتور سمير يعني يرأس كثير من الجروب اوف ستاديز يعني في ايجيبت وافريقيا وحتى في ايشيا. الدكتور سمير يعني credential as researcher cover estimated more than 24 projects conducted in Egypt وأفريقيا ويوروب ونورث and south of America وآسيا. الدكتور سمير كذلك has been instrumental established of the Egyptian group of medical ethics diabetes Scott project, the Egyptian group of for study of diabetes and the study of atherosclerosis. الدكتور سمير أسعد خليل he is the editor-in-chief of Journal of Egyptian Association of Endocrinology and Diabetes and Metabolism, member of the editorial board for more than 30 medical journals all over the world. Prof. Asad Khalil has published more than 236 research published paper in the field of diabetes, endocrine, metabolism, and immunology, and he is also author for more than 14 books of diabetes and lipid and immunology. دكتور سمير، شرف لنا أن يكون الأستاذ الدكتور سمير أسعد خليل متحدثا إلى مؤتمرنا للمجموعة اليمنية للغدد الصماء والسكري. تفضل دكتور سمير.
أحب أولا أتوجه بجزيل الشكر والامتنان لزملائي وأخواتي أعضاء جمعية السكر اليمنية والقائمين على المؤتمر لتشريفي باشتراكي في هذا التجمع العلمي الرائع. My talk will entail Medicine in Ancient World, Importance, Landmarks in History of Diabetes, Updated Data, Some Spotlights on the Future of Diabetes. This is orthopedic surgery and prosthesis in ancient Egypt. The records show that the Egyptians used emetics, purgatives, enemata, diuretics, diaphoretics, and others. Herodotus remarks that the country was full of physicians. I quote, "One treats only the diseases of the eye, another those of the head, the teeth, the abdomen, or the internal organs." In 1552 BC, the Egyptian physician Hesi-Ra of the 3rd dynasty makes the first known mention of diabetes. This was recorded in the well-known Ebers Papyrus. Arietius of Cappadocia, a contemporary of Galen, provided the first accurate description of the symptoms of diabetes. He was the first to use the term diabetes. The term diabetes was derived from the Greek word for siphon. Arietius' descriptions begins like that. I quote, "Diabetes is a wonderful affection, not very frequent among men, being a melting down of the flesh and limbs into urine." يعني وصف الكاتابوليك state. The following will be landmarks in the history of diabetes. In 1425, diabetes first appears in the English language. In 1869, Paul Langerhans discovered the islet cells of the pancreas. Eugène Opie established connection between the failure of the islet of Langerhans and the occurrence of diabetes. Eliot Jocelyn compiles 1,000 of his own cases and writes the textbook The Treatment of Diabetes Mellitus. He reports that the mortality of patients was approximately 20% lower than for the previous year due to the introduction of fasting and the emphasis on regular exercise. In 1921, discovery of insulin by Banting and Best. 1 year later, Leonard Thompson becomes the first person to receive insulin. Further, 1 year later, insulin was made commercially available. At the same year, Nobel Prize awarded to Banting and MacLeod. In 1936, Sir Harold Hemsworth, explaining to late Queen Elizabeth that diabetes falls into 2 types, based on insulin insensitivity. This discovery later led to the diabetes classification of type 1 and type 2. In 1966, the first pancreas transplant performed at the University of Manitoba, Canada. In 1971, the invention of portable blood glucose meter, called the Ames reflectance meter. In 1989, St. Vincent's Declaration declaring that the cornerstone of care for people with diabetes is self-management education. Then came the 2 most important landmarks studies in the history of diabetes. In 1993, the DCCT in patients with type 1 diabetes showed that better glycemic control is associated with significantly decreased rate of development and progression of microvascular disease. 5 years later, the United Kingdom prospective diabetes study links the control of glucose levels and blood pressure control to the delay and possible prevention of complications of type 2 diabetes. Then came the World Diabetes Day, established in 1991 by the International Diabetes Federation with support from the WHO. Diabetes Day became an official United Nations Day in 2006. At the same year, the United Nations designates the World Diabetes Day, November 14, in honor of Frederick Banting's birthday, starting 2007. Now from history to what is in the pipelines and future of diabetes. All this is a huge constellation of material under study. I will only throw some spotlights on only few of them. Now, the incretins multi-agonist, GLP-1 receptor analog plus amylin, CARGLYSEMA, phase 2 trial in people with type 2 diabetes. After 32 weeks, there has been a reduction in hemoglobin A1C of 2.1% and in the reduction in body weight by 15.6%. The triple agonists, GLP-1, GIP, glucagon. As you can see here, a significant decrease in hemoglobin A1C and a significant marked decrease in weight. Now, oral small molecules non-peptide GLP-1 receptor agonists like orforglipron for adults with obesity. As you can see here, there is a significant decrease in percentage body weight, about 14%, and also in the absolute change in body weight, more than 15 kilos. This has been published in the New England Journal of Medicine 2023. Bexicagliflozin, a new SGLT2 inhibitor. In January 2023, it received the first approval in the United States of America for use as an adjuvant to diet and exercise to improve glycemic control in adults with type 2 diabetes. And now it is undergoing clinical development for treatment of essential hypertension in the United States. Lobeglitazone, a novel TZD for the management of type 2 diabetes. It is 12 times higher in binding capacity to PPAR gamma than pioglitazone. Efficacy comparable to pioglitazone, but much more safe and tolerable. In fact, the total adverse effect is like placebo, the incidence of peripheral edema much lower, no significant difference in bone mineral density, and limited risk of bladder cancer. Besides, it has a pleiotropic effect on lipid profile as well as in the liver steatotic disease. Shiglitazar, a pan-PPAR. This time it is a non-TZD agonist of alpha, delta, and gamma PPAR being developed for the treatment of type 2 diabetes and non-alcoholic steatohepatitis as well. Imeglimine. Imeglimine is now in the market of some areas. It acts on the mitochondria and it has protective effect on the brain as it increases the size of infarction and neuronal damage. It affects the left ventricular function and improves heart failure and improves the kidney function. Now we shall discuss some agents targeting the receptors, like the glucose protein coupled receptor 119. It plays a critical role in glucose hormone. And will hopefully provide diabetic patients with significant glucose lowering benefits and a better safety profile. The thyroid hormone receptors. Thyroid hormone receptors have typically been targeted in the treatment of metabolic disorders, but they have also been shown to be attractive targets in the treatment of diabetes. There is one thyroid hormone receptor agonist which is currently active in phase 3 clinical trial to evaluate the safety and efficacy in lowering cardiovascular risk in patients with diabetes. Now there are some new agents targeting the enzymes, like diacylglycerol acyltransferase. It is a crucial enzyme which catalyzes the final dedicated step of TAG synthesis. Currently, at least one promising agent from this drug group has completed phase 2 clinical trial. Being a hepatoprotectant, it is not a classical hypoglycemic drug, but is indirectly affecting glycemia by increasing insulin sensitivity and protecting the islet cells of pancreas. The kallikrein-kinin system. This may provide an exciting approach for diabetes treatment. It has been shown that bradykinin resulted in increased glucose uptake and insulin sensitivity through the bradykinin type 2 receptor signaling. This therapeutic strategy is being investigated with DM199, a recombinant human tissue kallikrein-1 protein currently in phase 2 clinical trial to treat diabetes. Methionine aminopeptidase 2. This is an enzyme that cleaves off methionine from the N-terminus of new proteins. There is a clinical agent with promising results with improved glucose control and lowered weight in clinical studies and a recently completed phase 2 clinical trial. Now there are some agents targeting the enzymes like kinases, glucokinase, dorzagliatin. It is a crucial enzyme that maintains normal glucose homeostasis and has a glucostatic effect in the blood because it initiates gluconeogenesis. It is currently in phase 3 clinical trial in the United States, but it has been approved in China in 2022. Transporters. Mitochondrial membrane transport protein modulators. Impaired mitochondrial function has been previously connected with the development of diabetes and its complications. Potential efficacy in patients with type 2 diabetes and liver injury is now under study. Now, a glimpse into the future of insulin treatment. We target convenience by using or dreaming of using once weekly insulin, simplicity by using oral insulin, improve safety by using glucose-sensitive insulin, and cure by beta cell replacement. Let us talk about the Eli Lilly once weekly medication, insulin Efsitora alpha, basal insulin using the antibody fragment crystallizable domain fusion. So it depends on fusion. The present data were published in the New England Journal of Medicine and simultaneously presented at the European Association of the Study of Diabetes annual meeting this year, 2024. It is specifically designed for once weekly subcutaneous administration, and with its low peak to trough ratio, it has the potential to provide more stable glucose level, that is, less glucose variability, throughout the week. Efsitora is in phase 3 development for adults with type 1 and type 2 diabetes. Now, the once weekly insulin icodec, depending on acylation, it is not yet approved by the FDA. It is studied by Novo Nordisk. It has even better effect on hemoglobin A1C when compared with glargine and when compared to degludec, but it is still not approved. And since now we can have a once weekly insulin and we already have a once weekly incretin, so we can co-formulate both of them so having both of them once weekly. Not only the basal insulin, but also research aiming at ultra-fast acting insulin. It is, as you can see here in this figure, double higher exposure when compared to insulin aspart, and also the peak is earlier, significantly earlier than the usual fast-acting insulin. A smart insulin with built-in glucose sensitivity could reduce the risk of hypoglycemia. As you can see here, there is a molecule which senses the glucose level. So if the glucose level is below 5 millimole, that is 90 milligrams, the receptor binding activation is not working. When this increases from 5 to 20 millimoles, it is activated, the binding is activated, so activation leads to initiation of the function of insulin. Not only insulin, but also high-tech for better management of diabetes. This is the smart insulin pen. The smart insulin pen can calculate each dose based on current blood sugar level, carbohydrate amounts, meal size, active insulin, and settings prescribed by the healthcare provider. It can deliver accurate half-unit doses, help prevent skipped or missed doses, do the math for the patient when figuring out how to dose for a meal or correct a high blood sugar reading, keep track of the time and amount of each dose and reminds the time for the next one, notify when insulin has expired or exceeded its temperature range, send diabetes data to the healthcare team whenever needed, work with the smartphone or watch and popular diabetes data tracking applications. An old dream in the oral insulin delivery strategies. Many methodologies have been tried: nanoparticles, microparticles, hydrogels, tablets, capsules, ionic liquids, etc. Unfortunately, in January 12 last year, the Oramed oral insulin fails to meet goal in type 2 diabetes. And so we have a long route to run yet before having a good oral insulin. What about precision medicine? Precision medicine aims at better diagnosis, better therapeutics, and better prognostics. This is an example. We know now that type 2 diabetes is subclassified into 5 clusters. I will give some examples on. Cluster 3, severe insulin resistance diabetes. This is insulin resistant, high BMI, higher occurrence of chronic disease. When compared with cluster 5, mild age-related diabetes, older age onset, modest metabolic changes. The genetic variants also influence the anti-diabetic medication response. For example, this subtype is associated with decreased glycemic response to DPP-4 inhibitors, while this subtype is associated with a strong association with hypoglycemic agents like DPP-4. Not only that, it influences also tolerability. These are results derived from the Goddard study. The impact of genetic factor on gastrointestinal tolerance to metformin. Study has also shown that reduced function alleles of the OCT1 gene are associated with increased tolerance to metformin. Again, the genome. The genome-wide associated studies loci. Here, for example, associated with end-stage kidney disease, here with diabetic nephropathy and microalbuminuria. What about epigenetic-based therapies? Modulations such as by DNA methylation or histone modifications adjust the expression of specific genes. يعني ممكن يبقى الواحد عنده الجين لكن expression بتاعته ممكن نحورها. And this is, for example, by using nutritional epigenomics, like resveratrol. It improves endothelial function, insulin sensitivity, and myocardial dysfunction in obesity and type 2 patients. The results derived from work between Alexandria University and Moscow University. Resveratrol promotes foot ulcer size reduction in type 2 diabetes and has been published. The BET inhibitors. Ababitalone is an orally available small molecules that being evaluated in clinical trials for the treatment of atherosclerosis and associated cardiovascular disease. Now, teplizumab. Can we delay the onset of type 1 diabetes? Yes. This has been FDA approved in November 2022. It acts on the T cell and is indicated to delay the onset of stage 3 type 1 diabetes in adults and pediatric patients aged 8 years and older with stage 2 type 1 diabetes. Finally, the robot-enhanced diabetes care. Robot-enhanced diabetes care for middle-aged and older adults living with diabetes in the community. Both the diabetic patients and the pharmacists reported more positive feedback on the robot-enhanced diabetes care than self-concerns. Self-directed learning, comfortable interaction, vividness were the most focused when using robot to enhance management for the patient. And my conclusion message is that, dear colleagues, dream on, dream on, dream until your dream comes true. Thank you very much.
Thank you very much دكتور سمير. فعلا عملت لنا شوية يعني hope انه امل انه ربما فعلا يمكن نتغلب على الديابيتس والديابيتك complications. فشكرا for your target dose and excellent presentation, and floor is open for any questions for Professor Samir. دكتور سمير لسه معنا ولا غادرت؟ ها؟ غادر. طيب على الأقل البروف سمير يبعث الروبوت. بروف سمير هو قال بيكون على الهواء مشان الكوتشنز لو في أسئلة. لا هو سجلها وبعدين هو على الهواء لأي كوتشنز. إذن شكرا كثيرا للبروف سمير، وننتقل إلى السكند سبيكر. وقبل ما ننتقل للسكند سبيكر يعني تعذرونا لو أخرنا عليكم الغداء شوية.